This is a follow-up from my previous video, which discusses the most puzzling question in glaucoma. Before we discuss the answer, let's briefly review this puzzling question once again. So the most puzzling question is one which is never discussed or addressed in prevalent glaucoma theories. Why are the 1 million or so densely packed nerve fibers of the optic disc always being destroyed in an orderly peripheral to central sequence? The nerve fibers are never being destroyed randomly. This led to our second puzzling question as to how elevated IOP or any other risk factor by its direct single action could lead to the orderly peripheral to central loss of nerve fibers. The answer to this puzzling question is that only a mechanical process can lead to the orderly loss of nerve fibers in glaucoma. In other words, elevated IOP acting alone or any other risk factor can't result in the orderly loss of nerve fibers in glaucoma. Let's dive deeper into what may be that mechanical process. This mechanical process must first separate the densely packed nerve fibers individually for their orderly one-by-one loss. Even though that mechanical process may have resulted from the biological effect of elevated IOP on some important component of the optic disc. This important component must be a primary site of injury in both HTG and NTG. So then how is elevated IOP leading to a mechanical process? The explanation may be that glaucoma may be a two-stage disease. This involves the first biological stage in which elevated IOP is compressing the circulation of the border tissue of Elschnig, resulting in chronic ischemia and its degeneration. The degenerated border tissue will then lead to loosening of the lamina cribrosa from the scleral wall. The second mechanical stage includes sinking of the lamina cribrosa, resulting in a stretching and orderly severance of nerve fibers at the scleral edge, from peripheral to central. As shown in the schematic cross-section of the optic disc, the process of sinking of the lamina cribrosa and severance of nerve fibers would begin with the deepest peripheralmost nerve fibers closest to the sclera and will continue until the last centralmost nerve fiber has been severed. What enables nerve fibers to be lost one by one in an orderly manner? Sinking of the optic disc will loosen the prelaminar nerve fibers, allowing for their orderly one by one loss. Once they are secured in bundles in the lamina cribrosa, they cannot separate into individual nerve fibers. Thus, any injury in the lamina cribrosa could not produce the orderly loss which results in characteristic glaucomatous field effects. Which important component must be a primary site of injury in HTG and NTG? The border tissue of Elschnig is a collagenous tissue which keeps the lamina cribrosa firmly in place like an O-ring seal. The ciliary circulation supplying the border tissue and IOP are opposing forces. In both glaucomas, elevated IOP in HTG and normal IOP in NTG will compress the ciliary circulation supplying the border tissue of Elschnig, resulting in its degeneration. Degeneration of the border tissue of Elschnig appears to be the main factor in the pathogenesis of both high and normal tension glaucoma. Thus, the primary site of injury appears to be the border tissue of Elschnig in both glaucomas. Glaucomatous field effects such as generalized peripheral field constriction and arcuate field effects are indicative of nerve fiber exotomy. The splinter hemorrhages at the disc margin may be due to severance of the microvasculature, which are meeting the same fate as nerve fibers at the scleral edge. Retinal nerve fiber layer thinning is also indicative of nerve fiber exotomy. Glaucoma may not be an optic neuropathy, but an optic disc exotomy. Please like and subscribe if you'd like to see more content. Thank you.